Afternoon, everyone, and welcome to the Community Development and Wellbeing Committee meeting. I would just like to ask Councillor Chase to open us with a karakia, please.
Thank you. Whakatakatahau ki te uru, whakatakatahau ki te tonga, kia mākina kia uta, kia mātaratara ki tai, I he ake ana te atakura, he tio, he huka, he hauhu, ti hei mauri ora. Kia ora.
Thank you very much, Councillor Chase. Just starting off, whether we have any apologies, I'd just like to enter one for Councillor Long and potentially Councillor Franklin. Councillor Franklin may be joining us, but if I could move those, seconded by Mayor Tracy. All those in favour, please say aye. Against? Carried. Thank you very much. First up, we have our public forum. We have a fairly full public forum, but I would like to invite up Gareth Collins from St John's. Gareth is the Area Operations Manager for Central South, so feel free to come up to the table, Gareth.
Thank you very much. There we go, thank you. I'll try not to yell into it. Thank you very much for the opportunity to come and see you all. I've got a presentation which I'll try and make work. We did a bit of a rehearsal a minute ago and it worked, so I'll put that up on the wall. Alison has asked me 3 times to come to this meeting, and my apologies for not coming the first 2. One of them was work-related and one was personal-related, but I'm pleased to finally be able to be here. I'm going to talk a little bit about sort of what St John is, with the ambulance service, and specifically within the wider mid-central area and how it affects the Taurua region. And then I'm happy to take any questions at the end of it, because I'm sure there will be some. So I'll quickly log into this. Okay. Look at that success. Excuse me. So, as per the introduction, Gareth Collins is my name, and I'm the Area Operations Manager for Hatahoni St John within the mid-central area, and I'll explain the area a little bit more in a moment. I can hear myself in my own computer, and it's disconcerting. Right. Okay, so I'll go through a bit of general information first. So St John, as everyone's probably aware, is a fairly large organisation. It's about the same size as the Defence Force, which is an interesting fact to me, being ex-Defence. And the frontline ambulance is about the same size as the Army, roughly. So within the wider organisation, the parts that probably affect this community the most are community health services, which is the health shuttles, community health initiatives like telehealth and things like that, and the St John Op Shop. And then emergency ambulance service, where I work, are the event health services, which are the people that support rugby, concerts, etc. Wear a green uniform, same as mine, and I guess support the community at sporting competitions, etc. Ambulance communications, who take phone calls and dispatch ambulances. There's a hire headquarters up in Auckland, which we deal with on a daily basis, which is NOEC. Clinical services, which provide training, support, and the air desk, which provides the helicopter support. And then, my apologies, I'm actually on call as well, so I do apologise. I will. Sorry about that, team. One of those days. And then the frontline ambulance, which is where I work. The thin green line is something I stole off someone else. Okay, so we're divided into 2 regions. This is for context. So north and south, not very original, and the country is divided into 8 districts. So from the top, Northland, Auckland, Coastal Lakes, and Waikato. And then the southern region is ourselves, so Central District, Tasman, Canterbury, Southland, and Otago. And then the Central District is the central part of the North Island. So Taranaki, Wanganui, Ruapehu, Mid-Central, which is mine, and the Hawke's Bay. And that's my patch there. So we go as far south as Peka, just south of Otaki. As far north as Ringawahia in the middle there. On this side of the hill, up to Norsewood. And then out to Akatea on the coast. And then as far south as basically Ikitahuna, but it's the Mount Bruce Kiwi Sanctuary as the border. So a reasonably large area. For context, and it'll make more sense in a minute when I give you some numbers, they are the type of responses that we respond to. So a purple response is a cardiac arrest. That is someone who is actively in the act of dying. Okay, so they're more common than you think. Red 1 and 2 are people who are, there's probably better words to use, but I'll say at the high end of being unwell. Orange 1 and 2 is this potential threat to life, and green 1 and 2 are people who are, they might have broken their leg, or they might have had a bleeding nose or something like that. So that's kind of gives you a scale. So high acuity, purple and red, low acuity is the green jobs. Right, some stats, hopefully this will work. Okay, so within the area, that green patch I showed you before, I've got a full-time workforce of 100 at the moment, out of 116 positions. So we are down 16 people. Doesn't sound like many, but it's a strain. And it's across 4 different watches. So each watch does 2 days, 2 nights, and then has 4 days off. They're 12-hour shifts. As well as that, we have about 40-odd casual staff members. Most of them are ex-ambulance officers who work in the community or do something else, and then they do casual shifts for us as well. And we've got about 40-odd volunteers, roughly. So by day, within that green area, from Peka up to Rangawahia, across to Akatea, we've got 11 ambulances by day, on a good day. Obviously, illness and things changes that, but on a good day, we should have 11 on the road. Today, we've got 9. So by night, we drop down to 9. Again, that's on a good night. We've got 2 high acuity rapid response vehicles, and they attend to critically sick patients. You may have seen them around. The Toyota Hilux is painted yellow, and I've got our most qualified personnel in them, critical care paramedic, and to give you an idea of what they can do, they can basically anaesthetise someone in the field and put a intubation tube in their throat to protect the airway to enable them to get to hospital. As well, lots of other things, but that's the big ticket thing they bring. 1 low acuity response vehicle, and that's for chronically sick patients. So a lot of complex cases, and that's normally based in the Horowhenua. It's a single crewed SUV, and that individual responds to people with ongoing health issues. There's a lot they can do. They've got the widest scope of practice out of any paramedic within the organisation, and they can do a lot. And there's one of that skill set just been employed locally here within Danny Virk, not St John, but a separate individual. But they can provide a lot of care to complex cases, and particularly chronically ill people. As well as that, there's myself, so area operations manager. I have a team of 5, so 4 watch operations managers, and they follow the same shift pattern as their watch that they support, and 1 group operations manager who is the manager for the 3 stations in the Horowhenua. All response capable, we all drive response capable vehicles. Used to be that we didn't have to respond particularly often, but that's becoming more common now. At the moment, I'm the only ambulance unit that's in this area right now. So if something purple or red happened, I'd get paged and not have to go to it. Outside of Auckland City, we're the second busiest area after Christchurch Metro. So within the country, that green patch you saw before is as per the words up there. We've got one of the largest rural roading systems in the country. I don't need to tell you people that, you definitely know that. So we have got large roading systems that bring its own challenges. Lots of crashes within the area. Yep, you guys understand that. We're one of the largest areas geographically. So from side to side and top to bottom is quite large and takes a while to get around it. And often, and I'll put in brackets usually, demand outstrips availability. So it's not uncommon for us to have 5 to 12 jobs waiting when I came upstairs today, the tablet in my car told me we had 6 or 7 waiting 15 minutes ago. And unfortunately, that's normal. So some numbers from last year. I pulled these last year to get an idea of sort of the numbers that we attend. So within the mid-central area, we responded to 25,309 jobs from 1st of January to 31st of December, which equates to 70 jobs every day or 3 jobs every hour of the year, if you break it down, right down. And that's an increase of 600 from the year before. 600 doesn't sound like a lot, but it is when there's no extra resourcing to go with it. Excuse me. In total, vehicle allocations in that period was 43,000. So what that means is a car crash might take 3 ambulances and a manager and a critical care paramedic. So that soaks up resources. So 43,000 vehicle allocations is pretty high. 256 purple calls, so that's people, like I said, actively in cardiac arrest. Not all of them, but probably about 95%. Red calls were 10,345. Orange and green was that, and a lot of those are pretty sick people as well. Our triage system that we use on the telephone doesn't always convey what the person will be like by the time you get there, as you can probably appreciate. So the vast majority of those numbers are pretty sick people. This year so far, we're up to 10,930 as of this morning, and it's already tracking higher than the same time last year. 113 purple calls so far this year, 5,000 red, 5,815 orange and green, and 18,000 vehicle allocations. So the trend that was seen over recent years of more being required of the organisation is continuing in the same vein. Right, so challenges that we face. Single hospital at Palmerston North. So everything in that catchment area pours into that single hospital. So I don't think I need to tell everybody about the issues that poor old Palmy Hospital faces. They do an amazing job. They try the very best they can, and I take my hat off to them every day that I go in there. Yep, you guys are well aware of this as well. Split down the middle causes issues for us as well as I'm sure everyone in this room. But I guess the good thing is it's going to change very shortly. I can turn it down. Yep, that one as well. Don't need to explain it to everybody in this room. You guys definitely get that. And again, the good news is that's changing very shortly. Long transit times. So Dannyvirk to Palmy Hospital is about a 2-hour round trip for an ambulance, and Otaki is not much different. So the extremities of the area soak up resources, not because of the number of jobs they attend, but just the geography of it. Yep, large rural area and arterial road system, I mentioned that before. So State Highway 1 and 2 both obviously go through that area, which equals lots of crashes. And unfortunately, lots of bad crashes. Is there a good crash? Probably not. But lots of fatal crashes or particularly ill people. We seem to get the lion's share of those. Some of the arterial routes that we have don't have good shoulders, so it's hard to find places to safely pull over, which doesn't sound like much, but when you've got cars going past at 100 and you're trying to pull people out of broken cars, it's not that good, not that safe for emergency responders. There's very limited after-hour care options in the entire area, particularly the Tararua region, as I'm sure everybody in this room is aware. But the good news is I believe that's sort of in the process of evolving, which is really positive. Ageing population, yep, it brings its own health issues. As the population gets older, the requirement for ambulances and ongoing health care obviously increases. Yep, high level of deprivation in some areas, some parts of the area, and that's true across the entire area, not necessarily here or Horowhenua or Palmy. Each part of the region shares that same issue. It's getting hard to attract volunteers, and we have that issue. So fire, I believe, and other voluntary organisations have the same issue. So if anyone's interested in joining, I'll give you my card. Positives, there are some. New station being built in Paeatua. So that, as I know people in this room it's pretty warm to their heart, that was not looking good this time last year. But some changes were made and some money was found, and that is now going ahead full tilt, which is great news. I tried to get past there today, but unfortunately I got tied up at jobs this morning, so I wasn't able to. But the groundwork is pretty much all done, and it's on track to be completed by either late August or early September. So we are very excited about that. That'll be really good. We've got a working relationship with FENS and police, especially the volunteer brigades over this side of the hill. We routinely attend, well, car crashes is the main one, obviously, but purple response calls as well, so cardiac arrests. People aren't aware, fire, got an MOU with St John, with the ambulances in general, to respond, to provide support to cardiac arrest victims. And we've got a good working relationship with those groups. Same with Wellington Free Ambulance. I guess it's relevant for you guys over here because your border and theirs is kind of blurred. We work particularly well with them. They often send ambulances to back us up. The big boy racer thing over the weekend, we had Wellington Free up here supporting us over that as well. Happens on this side of the hill fairly often too, which is really positive. Good links in the community through various organisations. At different levels in my team as well. So from ambulance officers right through to myself, people are linked in all over the show, which is really good. We've got good connections with the 5 emergency management groups within the area, which is good. Extremely well qualified workforce, flexible mind and action. I like to plug my team because they're pretty amazing. That one. That particular cohort, the extended care paramedics, the ones that drive the low acuity vehicle, and the critical care paramedics are proactive. They'll look for jobs, they'll look for ways to support others, and they'll look for ways to provide clinical leadership to the other ambulance officers. The next point is pretty important too. So good out of hospital treatment pathways. We take about a third of all patients that we see take about 2/3 to hospital, and we leave about a third in the community. So there's a number of different local pathways for patients in the Horowhenua, less so over this side of the hill, but there's a whole lot being developed now through a number of initiatives that have been raised. We're working with those people at the moment, and when it's all sort of solidified, we'll get that put into our clinical pathways, and it will be available for people to use, which will be awesome. New Gorge Road, can't wait for that. We can transport to Masterton Hospital. Don't do it routinely, but we can. Same with Wellington. I'll be as quick as I can now. The blue stars represent ambulance stations. The green stars represent volunteer ambulance stations. That's what we have by day. So in each of those locations, we have that number of ambulances. The reason there's a star next to Frontline Palmy is that drops down by night. One thing I will say too at this point is just because an ambulance starts and finishes at a certain ambulance station, it's not like the fire service where they go back to where they started from. The next job that ambulance gets might be in Otaki. So the ambulance that starts in Woodville might pick up a local patient, drive across to Palmy Hospital, drop them off to ED. The next job, because they're next available, could be Otaki, and that's where they're heading to. Which before I came here 2 years ago, I didn't understand that either. But that's what happens. It's done on a needs basis, not on a locality basis, which I guess makes sense if I thought about it earlier. The other elements that we have, I spoke about extended care paramedic, that's a low acuity one, and response capable managers as well. Rapid response looks like that. In the first response units, over this side of the hill, we've got one in Ikitahuna. Debbie, for those that know Debbie, provides an amazing service. She does probably, I don't know the average, but I'd say about 10, 12 jobs a week, single crewed by herself, and she goes to some pretty sick people. So, I'm constantly in awe of what she does for her community. Major incident support team, I'll mention this at this point as well. So, it's a team of volunteers who operate the vehicle on the right, as you look at it, it's basically got a 12-person blow-up hospital inside it. So it takes about 15 minutes to set up, and it can hold status 1 patients, status 1 being bad, can hold them as a casualty collection point at a major incident. So we can take sick people, hold on to them as we work out a plan to get into the hospital, and that's on a 30-minute notice to move, done by volunteers, and it could respond across the entire area. As well as that, we've got a communications-capable vehicle. So there's a major incident over this side of the hill, we could bring that across and provide communications to police, fire, and ourselves. A few photos, that's what it looks like actually. There was an exercise at the airport last year. A few photos of the reality. Humanise the people that work there. They're all volunteers, the 3 on the left. Some kids that came to visit Living Station. Interagency is big for us. That's a new Living Station. The one in Paitoa won't look like that exactly, but it'll be along the same sort of lines, a little bit smaller, but visually sort of similar. Yep, more interagency pictures. Okay, these are my final thoughts. This is what we're not. We're not a taxi service. People sometimes think that we are. We get calls to take people across to Palmerston North or from Otaki to Palmerston North because they need to go to the chemist. It's not really an emergency that we should be having to deal with. Happens, I wouldn't say daily, but certainly weekly. We're not a replacement for GPs. Not just ambulance drivers. If you want to wind an ambo up, call them an ambulance driver. Not a convenient ride to town, or an inconvenient one sometimes. And we don't dispatch our own jobs. The reason I'm telling people in this room that is, I get that sometimes there's frustrations when people are waiting a long time, but it's not actually the ambulance officer that responds fault. It's done in Christchurch, and we're simply the doers of our master's command. What we are, okay, we're a service that's staffed with highly trained and qualified professionals and volunteers. It takes a long time to become a critical care paramedic, for example. They're pretty proud of what they can do. Yep, everyone in this organisation, certainly that I've anything to do with, has the same common purpose, and that's to serve the community that we're based in, and that's true. You never get rich being an ambulance officer. People do it for that reason. We are proud of the work we do, and one thing I will say too is that all my staff, myself included, we carry our successes with pride, but we also carry all of the bad outcomes as well. We try not to let those get out, but you can imagine that sometimes there's some pretty bad days in this job, and my staff do carry that around. Yep, and that moves into the next point. Pretty diverse group as well. We've got people from all walks of life, background, sexual orientation, and it doesn't matter. They wear a green uniform and they all do an amazing job. Yep, we're a charity that relies on the kindness and generosity of others. I know there's work at the top of the organisation to try and fix some of the funding issues that we do face. I'll just leave that there. But at the moment, that's what we are. We're grateful for the support and understanding the communities that we serve, and that's very true. Yep, I'm almost finished, I promise. So thin green line, I think I saw a blue-green line or something like that the police use, and I thought, I'm going to steal that. So I called it the thin green line, and it is often the difference between life and death. Yep. I'm proud of my team. I tell everybody that because they do an amazing job. I'm thankful for the chance to speak to you. It's nice to be able to come along and actually tell people that just because an ambulance starts and finishes in one place doesn't always go back there. And the reality is, unfortunately, sometimes areas are uncovered, but the only reason for that is because there's someone that's more sick somewhere else. And that's just the reality. If we had an endless supply of ambulances and people and funding, I guess that gap would be smaller, but that's the reality at the moment. And sometimes we do that. We do nothing more than go and see people because that personal connection often makes a difference to them and how their day and life is going. So, we do that quite often. So, happy to take any questions if anybody has any.
Thank you. Thanks very much for that, Gareth. It's a really powerful presentation that you've been able to give us to, I guess, show some of the realities within your organisation. Before we jump into questions, though, on behalf of our committee, we want to thank you and thank all of the staff and volunteers for what you deliver to our communities. I've seen firsthand some of the impact that ambulance staff can have, the compassion that they bring to the job, but actually on the flip side, sometimes some of the abuse that they have to suffer. And so I am incredibly grateful. I'm sure everyone on the committee is. We'll go through some questions. I have some myself, but I just want to kick off with our usual chair, Councillor Franklin, to open up the questions, please.
Oh, thank you, Chair Scott, and welcome, Gareth. We finally made it.
Yeah.
I don't have any questions. I just want to sincerely thank you personally. We've had so much toing and froing to be able to get you here, and it was really, really, really interesting to listen to. So I'm really sorry I'm not there today. I didn't need an ambulance, but I'm not well. So, but anyway, I just wanted to say sincere thanks.
Thank you, Alison. It's very kind.
Thanks very much for that, Councillor Franklin, and we are certainly missing you today, so I hope you're feeling better soon. Next question we have is the Deputy Mayor.
Thank you, Scott, and welcome, Gareth. And sorry, I'm also unwell and can't be there today. But thanks for your presentation. And I concur with Scott about the abuse you guys have to put up with. And I was in Levin on Friday when the Boy Racer event was on. So really feel for you guys for that event. So I just wanted to ask, just because we've got quite a rural community and out towards the coast, so I know it's quite a way for the ambulance to get to if you're in Herbert or Akatio, but we do have Pongaroa to back you guys up. What is the policy with getting a chopper out for any accident or in a rural area where it's going to take a long time to get to them?
Yeah, that's a good question, and one that I often ask myself, actually. There is a set criteria. It's called the ANTS criteria. It's on acuity of the patient, sort of likely outcome, availability of nearest or closest other resource, the weather, obviously something to do with it sometimes as well. That's sort of what the criteria is based on. There's a few other things as well, but generally speaking, it's controlled centrally as well, and obviously with a limited resource, they don't fire them out quickly, much to my and my staff's frustration, I will be honest. There have been times where helicopters have been requested and they haven't been sent. And part of the problem, and we're trying to educate people too, is that the people that dispatch it don't understand the geography of the area particularly well. They don't understand that, might look like not very far on the map, but it's actually a long way because there's lots of roadworks and it's twisting and turning. And the other issue we have in those areas that you just mentioned is quite a comms black spot out there. So quite often we'll ask for helicopter response before we even get on scene. Oh, good grief. I do apologise. That's my boss. I'll call him back. We ask for a helicopter response prior to arriving on scene, but the policy is, generally speaking, they need a clinician to look at it first, unless it's very obvious. What's an example of something where they wouldn't necessarily do that? Car versus car with multiple patients trapped, and police have said they're not very well. They'll probably send a helicopter quicker. If it's a medical job, generally speaking, they wait for a clinician to have a look at them first and then make a decision whether they need to send them or not. Part of the problem, like I said, we have is that the distance, but also the communication factor is an issue for us. I've actually been working recently with, I guess, my equivalent from the air desk up in Auckland about how we can improve the knowledge base around the people that dispatch those assets to try and reduce that time lag. I'm not sure I answered your question, but that's what I'm trying to do at the moment.
Yeah, no, that's great, Gareth. Yeah, it does always concern me, the rural community, farming community out there, and how long it can take to get an ambulance there. So it's good to hear that you're working with them to help them understand what our area looks like.
It's been a bone of contention
you.
for a while, actually.
Thanks very much for that, Deputy Mayor. The next question that I've got is from Councillor Wallace.
Thank you, Chair Scott. A great presentation, Gareth.
Oh, thank you.
My question to you, in the time that you've been involved in St John, pee, drugs, alcohol, this is this old adage, we've got the ambulance at the bottom of the cliff. How have you seen this change? And I've just made a couple of notes here. How many of your staff, I know the police go in first, but have ended up being in a situation they really don't want because of these mind-altering stimulants?
I couldn't give you the numbers, like actual numbers, but my awareness and gut feel is that probably all of them at some point. I've been in this organisation for 2 years, and there wouldn't be many ambos that haven't faced either violence or a threat of violence in that period. I'd say just about all of my staff have. Some recent examples I can give you are, unfortunately, it was the same crew. They responded to a job, called police for backup. Police arrived. As police got there, they were all trying to go in together. The patient went behind his house and came back with a weapon. It looked like it was an air rifle, but it looked like a rifle because it was 2 a.m, and they had to get out quickly because the person was armed. So they had a firearm presented at them, basically. Same crew, about a month later, had out towards Foxton. That was in the Horowhenua, and this was next example was near Foxton. Had a violent patient who was on meth in the back of the ambulance, started kicking off in the vehicle. They evacuated the vehicle. The person then jumped out, chased them, and then tried to run onto State Highway 1 in front of cars. They managed to tackle the person to the ground and sedate them, but not until the female crew member had the patient's vomit smeared all over her face. So yeah, that wasn't particularly nice either. So I can't give you an exact number of who has, but I would say just about everyone's got a story they could tell you. Yeah.
Thanks very much for that, Gareth. Mayor Tracy.
Thanks, Chair Scott. Great presentation, and it'd be wonderful if we could actually get a copy of that just to be able to reflect on some of those stats, because when I looked at sometimes it's pretty easy to feel a little bit hard done by, but when you look at the stats in Palmerston North, and it's sort of one ambulance per 10,000 residents, it sort of puts a little bit of understanding on those ratios. But my question is, what happens when the Pahiatua ambulance building is complete? How does that impact the Woodville ambulances and the makeup within the Tararua district?
It'll be the same amount of vehicles. So the Woodville's... I do apologise, me, Tracy. I'm popular today. It's all right. All those people can wait. The number of ambulances won't change. It's just the location of that. The Woodville ambulance is called Pahiatua 1. That's its call sign. It'll just go to Pahiatua. The Woodville station itself will go. If we had the funding to have another vehicle, it would be good to have another one there by day, based out of Woodville. But yeah, I don't unfortunately have much influence in that. So it'll go back to Pahiatua. Yeah. Ikitahuna's first response unit will stay where it is as well. Yeah. Well, I guess one good thing is that the road, with the new road opening, it'll reduce the time for vehicles to come from across the hill to get across here particularly to Woodville. It's not great news, sorry, but that's the answer. Yeah. I tried to pull some numbers today for Tararua specifically. I managed to get the numbers I gave you this morning, and then our system crashed. So I couldn't get specific Tararua numbers, but what I will do is when it's up and running again, I can fire some through. I'll send to Alison if you like, and it will break it down by Tararua specifically, and the 2 vehicles in this area that are permanently across here, how much work they do. I can draw In fact, it's easier if I just draw it off all ambulances, probably, because it's not just, I mean, the Palmy ambulances spend a lot of time over here as well. It's not unusual for Otaki or Levin to be across here too. So I'll do a poll of the locality and I'll get those numbers through. But yeah, the system died this morning, of course.
Thanks very much for that, and thanks for the question, Mayor Tracy, because it is something that does pop up a little bit. The community very excited about the Pahiatua station, but having some concern for the relocation of the ambulance that is currently based in Woodville. These are always really helpful for us to get the information, because even knowing that there's an ambulance based in Woodville or in Pahiatua, it doesn't necessarily mean that ambulance is going to be there, because it'll be out on jobs. So that's very helpful. Thank you for answering all of those questions. Do we have any final questions at all for Gareth?
I have one last point. Sorry, I can just mention. We have a thing called it's basically a predetermined deployment plan. And Palmerston North is if we need an ambulance sent somewhere and we've got a spare one, it'll go to Palmy Station first. Second on that list is Dannyvirk. So it's prioritised to get a vehicle across the Taurua above the Horowhenua. So yeah, that's built into our dispatch system, that if there's a gap over here and there's an ambulance available to cover the gap, it'll get sent to Dannyvirk Station first. To provide coverage, because obviously they don't just cover south, they also cover north. They often go to Waipaku or further afield as well.
Thanks very much, Gareth. Mayor Tracy with another question.
Thanks, Chair Scott. I just thought I'd go out on a limb. You said that if you had another ambulance, that Woodville could be considered to stay open as a day ambulance. What would a vehicle like that cost if we put some effort into how we could make that happen?
A frontline ambulance itself, the machine is about, with all the bits and pieces in it, is around about $300,000. It might be slightly less than that, it might be 280 or something, but we'll call it 300K. The staffing to crew that, if it was days only, would need 8 staff members, a paramedic and an EMT, times 4 watches. So that'd be 8 staff if it was days only. We don't own the building either, so I believe that the building that's sitting there at the moment is reverting back to the owner once we're out, is my understanding. Yeah.
No, thanks for that question. It was certainly floating around in my head as well. Gareth, thank you very much for coming in, particularly with you being on call. I note that you've apologised for your phone going off.
I'm very sorry.
That is absolutely unnecessary when you're coming in, giving your time while you're on call as well. So we are absolutely grateful for you coming in, making the time to share some of that story. And as a committee, it enables us to be able to go and spread that word further for you. So we really appreciate your time, Gareth.
Thank you very much. It's very kind. I'll take those kind words back to my team. Actually, I'll email them today, and I will put that message back to my people from all of you here today, and it'll make their day, I can tell you. Yeah. Thank you very much. Cheers, everybody. Thank you. I don't know how to turn that off.
I'll flick the microphone over this way, and then you don't need to worry about that. Thank you very much, and safe travels, Gareth.
Thank you so much.
Next up in public forum, we have Te Kahu Hauora. Now, this will be just a really brief presentation, just as a bit of an update as to how they're tracking. So I welcome up Tania Chamberlain.
Kia ora. Is it close enough? Apologies, I've also had the bug, so if I sound was a little bit unwell. I am still recovering. Ko tāne Chamberlain Takawinga ko Ngāti Kahungunu ki Tamaki Nui Aroa Kumahi. I'm the Te Kahu Hautu at the Kahungunu iwi office tauwhenua here. That's the Chief Operations Officer. Apologies that we haven't prepared a presentation. Skimming through my emails has come back to bite me. I didn't realise that this was this type of forum. When Alison asked us to come, I thought it was just a kōrero about all of the services and what we're doing, but happy to come back with a proper presentation at some time, which would be really cool because we do have a lot of services. There's so much interest at the moment in our GP clinic, Te Kahu Hauora practice, but we have actually been providing hauora services for the rohi since COVID really. So I would like to, get that opportunity to come back and probably talk about our complete packages of care that we have. Little update, I guess, with our clinic. I'm sure most of you are aware, but just a brief background of how we come to have our clinic. It was always the iwi's moe to have a GP practice. However, that was in our long-term trajectory. It wasn't until we were approached by several clinicians that were going to be leaving the area that we decided we needed to mobilise and set up a clinic. We've had no funding for this. Basically, the iwi is supporting us until hopefully we can pay that back and be self-sustainable. Our space is obviously a huge issue for us, and we did initially look at where we could do this. Because of restraints in funding, we've had to kind of tie-ho and sit in our current space, and it's working really well at the moment. However, as we get requests for more staff to join us and more patients to enrol, we are going to have some serious conversations about where we could go in the future. So we've nearly been open 3 months. We've currently got 1,100 patients enrolled. 650 of those are Māori or Pacifica, and we still have enrolments coming in every day. We obviously have our other services as well with our social and hauora services, and what we're noticing is the wraparound hub type care that we're providing is working really well. So those services with our GP clinic and our other services just being able to wrap in. So Dr. Jane Laver might refer someone to our whānau ora service and vice versa, and we knew it would work well, but actually seeing it in action is amazing, and it's working so well. So much so that where our model of care is getting watched and looked at quite a lot from Te Whatu Ora and some other large practices around New Zealand. They just think what we're doing is pretty amazing, which we do of course as well. We currently have a house surgeon. We have a house surgeon for 3 months, which is very uncommon for a practice our size to have a house surgeon. We have another one coming when this one leaves. We've had another one ask if they can come, so that's kind of 9 months of house surgeon. We have an intern at the moment, and we've had more requests for interns and training nurses as well, because people just want to work in the space how we're working. Which is amazing, but also very difficult with space. It's a really amazing problem to have, though. What we've noticed, just I guess a few little antidotes of what we've kind of noticed in the last 3 months, is that we've had a huge number of people who have been unenrolled come in and enrol with us. We've had people that have not accessed GP services, even though they were enrolled. We've had people that have not accessed GP services for 9 years because they've not felt that they could access services anywhere else. And they've come in, and that's been really good. We've had many enrolments from out of town who haven't been able to enrol where they live, and so much positive feedback about being able to get a same-day appointment or next day at this stage. So that's been huge. As I said, our model of care is attracting a lot of interest, which is great for the Tararua region. I'm a part of the Rural Taiwhenua Hauora Network, and I've been asked to do some presentations within that area as well, and it's just really highlighting what we're doing in the rohi. talked about how the services wrap around. Our house surgeon's also been going down to Woodville, so you know that we've got our Woodville clinic down there. So we have our nurse-led clinic work out of there 1 day a week, and we lease 1 day a week to THG, and the house surgeon's been going down there with our nurse-led clinic. As we get in more enrolments in Woodville, we'll start a day clinic down there as well with the GP as well as the nurse-led clinic. Our GP and nurse practitioner are also very keen to get out of the office and get around to our rural areas alongside our nurse-led clinic. So with our mobile service, we've got our RV, and that goes all the way up to Akatio, Pongaroa, Paihetua. We do Woodville once a week. They're all over the place, and the nurse and prescriber and GP and nurse practitioner are going to go on a bit of a rotation to go out to those services as well. So we'll actually have a GP out there, which is going to be huge. We're working with other practices at the moment in that after hours care space, but as you know, that's really quite a difficult space to navigate. So that's a kind of a work in progress, really. We have our nurse-led clinics on Wednesdays here in Dannevirke, and that's a late night clinic, and that's just walk-in. We've noticed the increase in foot traffic through there since we've also got the practice as well. Same with Woodville, we've noticed increase in numbers in Woodville as well. Our team go all over the rohe and do a lot of immunisation mahi, and that's been really we've boosted our numbers for Tararua. Te Whatuora are really impressed, and so we're hoping that they're going to give us some more funding for the going year. So we've got our fingers crossed on there. Funding is an issue, obviously, with our other services. With the changes that have been made in that political landscape, we have lost some of our funding, which has put a bit of pressure on the clinic as well. But I'm just constantly putting RFPs in to try and get more funding and services. So that's pretty much that in the clinic and my full-time two-part full-time jobs. As I said, space is an issue. We do have I guess our more we are going forward is one day we'd like to have a large hub type space where we can have sort of the acute centre, all of our other social services in the space as well. Before we opened, we did a lot of community engagement, and that was to really get a feel of our community and whānau and asking what they would like going forward for their healthcare, for their clinic. And the feedback we got from that was so rich. And it is a big space, a one-stop shop where they can go and have rongoa and miri and see a GP and see the nurse and go down the hall and talk about nutrition and how do we garden and how do we cook with our pātaka and all that kind of thing. So that is definitely where we'd like to end up, but of course that will be related to funding and maybe winning lotto, who knows. So we pretty much run on the smell of an oily rag. Our funding, our income comes from capitation, and we've had some capitation conversations last week, which were not great for us as a small practice. Large practices will be getting some flexi funding bulk money given to them, but our smaller practices in the area will not benefit from that. So that's a bit of disappointing news that we had last week. So we're going to be meeting with the PHO to kind of try and nut that out a bit better and see if there's, being a new practice, flexi funding is going to be worked out on historical data. We don't have historical data, so we're just trying to navigate that space at the moment. But yeah, I would like to come and present our whole suite of services that we provide. And I guess a little plug here that we've got our Matariki celebration coming up on the 4th of July. That's really important to us. It's we have over 2,000 of the community come through with fireworks and food trucks and all that kind of thing. But the most important part is our health promotion side. We have Think Hawara come over. We have all of our team there. Lots of free giveaways, lots of information, just try and get whānau to come and talk to us about whatever their health needs are, and health being health and wellbeing, so not just about hauora as we currently look at it. So That's it really, but happy to take questions and apologise, it's not a presentation.
Tanya, thank you so much for that. And who would have known that you hadn't prepared? So obviously,
Well, if you looked at my scribbles, you'd know.
live and breathe it. We will open up to questions in just a moment. But thank you for all the work you and your team are doing, focused on the healthcare of our wider district, not just here in Dannevirke. So incredibly grateful for that. It was a real honour to attend the opening of when the service started, and it was a really special day. So just wanted to reflect on that. I already have a couple of questions in the queue, so I just want to start off with Councillor Franklin, please.
Thank you, Chair Scott, very much, and thank you so much, Tanya. I've been looking forward to this. It's been a work in progress, but please don't apologise. I found that really, really interesting. I mean, you might have scribbled some notes, but you know it inside out. So I just wanted to let you know that I've already diary noted to invite you again. So watch this space. I'll be back, and it's lovely that you don't have too far to come.
Yeah, just across the road. It's great.
Across the road. Thank you so much, Tanya.
Thank you.
Councillor Wards.
Chair Scott, and well done, Tanya. Good to see you, Andrea. Congratulations on behalf of our community for seeing the opportunity and taking what could have been very challenging and catalysed something very positive. So well done to the team. I have two questions for you. You hinted at one of them, Tanya, and that was with regard to after hours and looking at collaborating with obviously other providers, but it's probably going through people's mind with the budget announcement around additional after hours funding. Where do you think that might be utilised in Tararua? Because we won't be getting, a fancy A&M centre being opened like they might do in an urban setting, but how do you think they're going to want that funding delivered in our setting?
So that's a really good question, and one that we've been asking as well. So we don't actually have a lot more information than the general community does. We've attended a hui with Te Whatu Ora, and that's just been we're at the very early stage. They're moving at pace for the sites that they're going to do new. The Dannevirke was sort of mentioned down the line. That's kind of going to be 2027, which it's not really great because, we're in a position now that we need to do something, which I've voiced. So obviously I go to a lot of these forums and I'm always saying, what about us? What about us? The last meeting we had, we did ask how is this going to be rolled out to areas. So if there's several providers, will it be an RFP situation? Because I guess we want it to be fair. It can't go to the biggest provider or the smallest if they have this resource. It's about, do we work together as a community? Is it a mutual space? Is it run? So there's all of those questions that we've been asking at the table, and nobody has kind of given us an answer yet. Definitely, I think from Te Whatu Ora, they are thinking the fairest way would be an RFP. So that's, I guess, just ensuring that we're positioning ourselves as a community ready to do that. There's not really, I don't think an after hours space is something that can be done in silo, because all of the GPs in the area will need to be on that roster. It's all good and well giving out money and making new clinics, but where are the staffing coming from? And so I think that's where we need to focus on. Did that answer the question?
Yep. I figured that might happen. And for my colleagues around the table, Tanya, in one of her previous roles, was an expert at doing rosters around GPs and trying to get communities to work together. My last question through you, Chair Scott, is the hospital and how Ngāti Kānunu and this particular service are going to be able to work through supporting admission of patients to hospital and any of the ongoing care that
Yep.
I know that some of your patients probably will require, but how have you managed to negotiate that arrangement?
With obviously the hospital is funded from Te Whatu Ora, so it is a community resource there. So as a provider, both ourselves, Kahunu and Dannevirke Family Health, will still be able to refer patients into there. However, we also have got our staff are doing rostered shifts in the evening as well, so our team is still on call, and same with Dannevirke Family Health. So they're still covering that roster to cover the hospital. At this stage, we've had no conversations about what that looks like going forward. Currently, we are admitting our practitioners are looking after our patients that are in there, and that's how we're kind of getting around it at this stage. Yep, so rest homes, exactly the same. They're still currently with THG at this stage. Yep.
Councillor Wallace.
Thank you, Chair Scott. Yeah, the questions are similar to what Sharon's mentioned. In the past, we used to have doctors on a permanent roster, and there was no question each doctor had a turn. There's a sole doctor in Dannevirke, which you know is practising, and in the past, sometimes they couldn't get access to the hospital. So I would really be interested in, because you guys are new on the block, congratulations. Going forward, I hope that we do get this community deal going together, because obviously Te Aroha Health Group, with their availability down there with the asset, and if everyone can feed into it, and if everyone could just focus on what we need to do is the health betterment for the people. So my major question is, you've had some preliminary chats. In your heart of hearts, do you think you're going to get this across the line so everyone works in one direction for the common good health of our district or in this particular area? And secondly, is the vibe good down there to use that facility? Because it doesn't seem logical from a business point of view to go and set up other bits and pieces, because we want everyone to succeed here. Because I think you would agree, and everyone in this room would agree, it's paramount health. The health is paramount in this, what we want. So, yeah, I hope people's ideologies and own little sticks in the mud don't stop the vision I think everyone's got in this room. So, on that, just in final, do you think you're getting a good vibe?
So I guess, you're putting me on the spot here because I can't really comment on a lot of that. That's not in our control. I don't run THG. I don't run the hospital. When you've said, though, the new kid on the block, I guess I'm quite an old kid on a new block. I ran city doctors for 6 years. I know that after hours care space. I know acute care like the back of my hand. I also ran THG for 3 years, and I also worked for Omni Health as a national operations manager looking after 18 GP practices across New Zealand. So I guess I know my stuff, and perhaps that's why we've been able to ensure that our service does have access to the hospital, because I'm quite aware of the contract that is. It should not be isolating. That contract shouldn't isolate. That is funded for a community. Everyone should be able to use that. However, everyone also should be able to help on that roster. So it's a cuts both ways kind of situation. Yes, we can transfer patients in there, but we also choose to help them cover the roster, because we can't sit back and say, you look after the hospital, here we'll funnel all our patients through when they're our patients. So it goes both ways, I think. Yeah.
Supplementary quickly, yeah. In the old days, that's how the doctors worked. They all worked together.
Yeah.
Nobody burgled a customer. They went in there. If they were on call, they'd look after them, and so on it would go.
Absolutely.
I would just love history to repeat itself.
Well, I think on that, we are finding that, and I think Andrea would probably support that, all of our GPs, all of the staff that are working within our service have actually said it feels like we've gone back to how GPing should have been and how it was back in the day. So I think, but we just need to continue that. Yeah.
Thanks very much for that, Tanya. And final question to Mayor Tracy.
Thanks, Chair Scott. Doing great things, and it's awesome, and the uptake's been huge by the community. I guess with it, same with the after hours, those were the questions. You know, we're rapt to hear that announcement, but 2027's a long way away. I guess we advocate in that health space, but if there's anything that we can do to connect and make more services available in the Tararoa district, then please just let's work together, because that's one thing that our district needs more than anything. So
absolutely, and appreciate that, because you know we are doing a lot of that pushing for our rohi, and particularly in that rural health space. It is at Kahununu's goal is to have is pretty much just to care for our whole community. It is not just Māori and Pacifica, as you can see by our numbers of patients that are coming through. It's to prevent them having to travel over to the hospital. And whatever that looks like, we want to do. And, you know, if we can't work with people, then we'll figure out how to do it. And that's kind of what we've done with this space. So, we know the need and how important it is to keep those that we have here, but also have a space for growing those that want to come. We've had a lot of inquiries from young GPs who are whānau here and have gone away to work elsewhere in Gisborne and Wellington, and you know, like if there's a space for them to come back home to work, they will come home. A space that aligns with their values. Yeah, so that's our focus.
Tania, again, thank you very much for coming in. It was a really insightful presentation, so incredibly grateful for that. For Andrea's time as well coming in. Always lovely to see you both. You're always very welcome in the chamber, and I look forward to Alison organising that time to go through all of those other services. But keep up the good work, and thank you both very much. Now, I don't often get to chair, so seeing as I have that opportunity today, I may just shuffle the agenda up very, very slightly, because we have one last presentation with guests in. So before we go into the minutes, I would like to invite up Naomi Manu from the Te Pai Oranga or Ruahine or Tararua Iwi Māori Partnership Board.
Tēnā tātou. It's lovely to be here with you all. Thank you very much for having me. Thank you, Alison, for inviting me and for that warm welcome. Scott, thank you.
Sorry, just one very quick second. I think we're just going to work to get your presentation up on screen, so members of the public viewing are able to see it. Councillors do have a copy of it on their iPad, but we'll just get that up on screen in just a second.
Thank you. Thank you. Tēnā tātou katoa. Te tuatahi he mihi nunui ki a koutou te kahui rangatira o te kaunihere hera nei, nei rā te mihi nunui ki a koutou. Ko wai tēnei, i te taho tōku pāpa he uri no rangitānu ki Wairarapa, he hononga hoki ki Ngāti Raukawa ki te tonga, and i te taho tōku mama he uri no Ngāti Kahungunu. Nō reira kei te mihi. So I'm Naomi Manu. I hail from a few areas. So I grew up down in Masterton. I have connections over across to Raukawa in Otaki, and also to Ngāti Kahungunu here, Wairarapa, and also over in Wairoa. And I live in Palmerston North. It's really wonderful to be here. I'm the Chief Executive of Te Pai Oranga, And I've been sitting in the chair for about, since the week before Christmas, actually. So maybe about five months in the role, and it has been tremendous. I'm grateful for the opportunity to come and have a kōrero with you all today, and have the opportunity to speak to what the purpose and function of the Iwi Māori Partnership Board is. And I think as we start to gear up to really build more momentum around our purpose and function, and part of that is helping and sharing what it is that we actually do, and building a greater level of understanding around what our responsibilities are and how we are positioned to serve the community that we have the great honour of living within. So the Iwi Māori Partnership Board, it's representative of the 7 iwi across our region, and so within the Tararua area we have representation of Ngāti Kahungunu, ki Tamaki Nui Arua, and also Rangitane o Wairarapa, or Tamaki Nui Arua, rather. Trying to insert my own iwi associations in here too. So we have within our board structure, we have 10 members on our board, and 2 of those members represent the iwi from the Tararua district as well. What's really important as part of that is we're a little bit different from that perspective of an Iwi Māori Partnership Board. Many Iwi Māori Partnership Boards, there's 15 across the country, many of them are skills-based. And so we have the luxury of not only having skills-based representation on our board, but we also have iwi-based representation. And so that positions us really well as an Iwi Māori Partnership Board for this particular region, because we have the collective impact of the 7 mana whenua right across our area as well. But importantly, as part of that, we have direct engagement and involvement of iwi that drives the work that we do within the Iwi Māori Partnership Board, which to me makes a lot of sense as well. And I think that also speaks to the potential power we have as an Iwi Māori Partnership Board to drive service and drive outcomes for our communities that we serve. What also is really important as we have our board structure is, as part of that, we also ensure that we respect the leadership of iwi across each of the districts as well. So we operate across 5 districts within the region, and we certainly look to Rangitane and Ngāti Kahungunu for their leadership in what occurs within the Tararua district. Now, our purpose and function derives from the Pai Ora Healthy Futures Act 2022, and within that there are six key functions. Oh, sorry, that PowerPoint is there are 6 key functions that we derive from the Act. And those functions, key and critical, and I suppose at the heart of those functions sits whānau voice. And so we really, as an Iwi Māori Partnership Board, we really honour the fact that we represent the interests of whānau. And so as part of that work, we spend time in community and gather whānau voice with providers, with iwi, and with our community, to be able to gather whānau voice and to be able to identify, through that process, what are some of the key priorities that whānau would like to see, and what are their aspirations in relation to their health. Now, why that is so important for us and critical for us, because a big part of what we do and who we represent is to ensure that we have whānau sitting in the driver's seat of their own health outcomes. Why that's important is because we need to ensure that we are responsible and accountable back into community and back into whānau. And that responsibility that we have is really important to us because it provides us with the mandate for us to exist, and also provides us with an important mandate to ensure that we remain aligned to what the needs of our community actually are. and continue to stay in touch with what the needs of our community are. So whānau voice sits at the heart of what we do. There are 5 other functions that we derive from the Act as well, and so the first one is rohe oranga priorities. Now, rohe oranga priorities are those priorities that we draw out of whānau voice, but those priorities are identified as high-level priorities that we will work to advance as part of the work that we do. So within this community, those rohe oranga or local priorities include mokopuna ora, family harm, the reduction of family harm and oral health. In addition to that, we have important monitoring and commissioning functions as well. So as we look to our rohe oranga priorities, we'll be monitoring some of those elements within those priorities as well, and identifying areas where there are gaps for additional service provision. But in addition to that, and as important to that, if not more important, is identifying what are the strengths that we have within our communities and how do we use and advocate for opportunities to scale up the things that work. And that's really important, because often when people think about monitoring and commissioning, they think about what are those gaps and how do we plug the gaps. Whereas for us, a really large part of that is identifying what are the amazing solutions that are already found within community, and how do we put a spotlight on those, because those solutions are powerful, they're innovative, and they're driven by community themselves. So how do we spotlight some of those, and how do we leverage the influence that we have as an Iwi Māori Partnership Board to start to look at how we might scale those up? And so then the commissioning element comes into one of our legislative functions, and the commissioning element is working closely with Health New Zealand to identify what are those things that we think that we should scale up within our communities, and how do we influence the commissioning of services and drive additional resource from Health New Zealand directly into our community. So we play a really important role in that, and that's attached again to our monitoring function, which is attached to our whānau voice function. So there's this clear line of sight from whānau voice all the way that drives through the work that we'll do, all the way through to commissioning. Of course, we'll then continue the cycle of monitoring, continue the cycle of commissioning as we grow and develop and evidence the outcomes that we're seeing within community as well. There are 2 other areas that are key to our functions. One of them is our workforce development. So at the same time as we're running our monitoring and commissioning, we're having a look at what are some of the capability areas that we need to explore, that we need to monitor, that we need to highlight, and that we need to advocate for increased investment in delivering this capability within communities as well. The last one is reporting, and that's 2-pronged. So reporting, the reason I say it's 2-pronged, because just as important as it is for us to undertake compliance reporting, we derive funding from the government itself. What is more important is the responsibility that we have to report our activities back into community. And so that community, just like we're held accountable by government for the funding that we receive to do our work, to perform our monitoring and commissioning functions, we need to emphasise that the accountability that we have back into our community holds equal, if not more weight as well. And so that keeps us centred, and that keeps us focused on what our purpose is and what our responsibilities are to our community. There's just a couple of other things just that I'd like to highlight. There are 3 key elements of the work that we do. So I mentioned before the whānau voice, evidence and policy, and then monitoring and commissioning. Now, that evidence and policy part I didn't mention before, but that's kind of where we spend a lot of our time really in understanding, and that's part of the monitoring function, but it's understanding what are some of the data insights that we're receiving, and that's quantitative insights that we're receiving from health data, but what is also the qualitative data that we're receiving from families, from communities, in order to help shape our priorities moving forward. And so that evidence and policy function is really important part of what we do. And as part of that, there may be things that are happening within the community that the community might say, actually, Ngāti Kahungunu are doing this amazing work with their GP service. That could be something that we come along and walk alongside them and monitor, and then look to provide in using the skills and also the capacity within our own team, within the IMPB team, to be able to develop some evaluation tools, or to develop some a monitoring report based on what is happening there that can be used to scale up services. So it's those types of things and those types of skills that we have within the IMPB that we can leverage to support what the community is doing, and importantly, what those community-driven initiatives are. In addition to kind of our statutory functions, the way that this actually works is we have a community health plan, and the community health plan is called Te Pai Anamata, and was developed as a result of the gathering of whānau voice, interrogating health data and identifying what are the priorities across our region. And so one of the key elements of our community health plan is what I mentioned before, those rohe oranga priorities. So those key priorities that are local priorities identified by the local community, but are broad enough because what is important to Tararua is going to be different to what is important to Horowhenua. And so it also acknowledges that there are differences across the 5 regions that we serve, 5 districts that we serve, that there are differences in their space within those priorities to be able to work and support communities and the differences that might exist across communities also. Now, there's just one other thing that I wanted to mention about Te Pai Anamata is there was a localities approach that you will be aware of. Back in 2022-23, there was the localities approach, and so the localities approach for our region was led by iwi, and it was in a localities approach to identify what are the key priorities and what is the community health plan for this particular region. Recognising that within each locality there may be a different locality plan for each of the 5 localities. So as you will also know, there was a departure from that model as well, and then there was a little bit of a period of around about a year where no one really knew what was happening, and then very quickly last July, iwi Māori partnership boards were asked to provide and develop a community health plan, and we needed to have that community health plan and submit it to the Minister's office by the end of September. So there was a very quick turnaround from the request to develop our community health plan to submitting the community health plan. And so the Iwi Māori Partnership Board went around, undertook whānau workshops and community workshops in relation to the community health plan. Now, what's important for me to just point out is there's a difference between the localities approach and the community health plan, where the localities approach was the plan for the whole population. The community health plan that the IMPB is responsible for is the community health plan for the Māori population. Having said that, it's the community health plan for the Māori population, but it also serves all people. Now, the reason I wanted to raise that is there's often a misunderstanding that the community health plan effectively replaced the localities approach, but it didn't. It's different from the localities approach. So what is happening, what Health New Zealand is doing, is they're developing a regional health plan, and the regional health plan is the health plan for all, a whole of population health plan. So that is developed at a regional level, and when I say regional level, that's the Ikaro region as well, and it's being led by Robin Shearer. Now, once that plan is developed, it's a whole of population approach, and that's how funding of services within this region will be determined. So initiatives that are included in the regional health plan will be funded for this region. Now, the community health plan that the IMPB has done for the Māori population is not funded. What our responsibility is to get elements of the community health plan into the regional health plan. And that's the way that the community health plan can be funded if it's part of the regional health plan. So I just wanted to also clarify, what is the purpose of the community health plan, and that's identifying what are the priorities for whānau Māori within this region, but noting that actually elements of the community health plan are going to be funded as a whole of population approach as part of the regional health plan. But that's sorry, yeah, it's an awful lot, and it's an ever-changing landscape, and I have some notes here that I'll send on and for you to share. But thank you so much for your time and for your attention and for the opportunity that I've been granted to come here and explain who we are and what we do and how we can serve. Nō reira, kei te mihi atu ki a koutou.
Kia ora, Naomi. Thank you very, very much for your presentation. For anyone that is interested in some of the detail watching online, the full presentation is available in the agenda on the council website, and there's some really interesting information in there. So thank you very much for your presentation. I'm just going to open that up to questions. The first, Councillor Watts.
Thanks, Chair Scott, and thank you, Naomi. It's been lovely to finally meet someone from IMPB. Just to set the context, I used to chair the Tararua Locality Group. So, and Alison, who's the chair of this committee, was also a member of that. So her and I have some particular interest in seeing the journey from back then when we were told, no, we're going to do it a different way, through to now. And thank you for that explanation about there was quite a hiatus there where no one really knew what was going on. I was privileged to attend the Rural Health Conference, of which Andrea and Tanya behind us were there, and there was a very sobering presentation from Carlton Irving that presented some rather horrific statistics around Māori health outcomes. And so I guess what I'm trying to understand from the IMPB perspective, I mean, it sounds to me like you're all about reporting, monitoring, advocating, but there's no money, honey. Yeah. Pretty much. So out of the development of your community health plan, what would be the targeted areas for Tararua? Because you've reflected this five different districts, all with slightly different needs. Part of the journey that you've come on, they were going to use Live-In as the prototype, yes, and that's right. No one ever heard anything more on that one. So what have you identified as priority areas for Tararua that you will obviously be including in your community health plan that might be planned in a regional level and we might get some money, honey?
Yeah.
What does it mean for Tararua? And what are you most proud of in your journey when it comes to outcomes for this particular rohi?
Thank you.
Big question, yeah. Sorry.
No, please don't apologise at all. Thank you. There are a couple of parts to the response to your question. The first one is, as we identified the three rohi-wide, so mokopuna ora, oral health, and the third one is reduction in family harm. So those are the three broad priorities. So all of right across our regions, the 5 districts, that will be the overarching feature of it. Within the districts, there'll be different things that we might look into. So, for example, within this district, there may be other elements of an approach to reduction of family harm that we might have a larger focus on, or there might be elements in here where we may focus or shine a spotlight on immunisations and tamariki order, and certainly immunisations is a big one for this community, and particularly because the immunisation program at the moment is a little bit under threat, as there is as we work to try and scale up the initiative as a result of losing some of the funding from whānau water provision. So that's something that we'll need to respond to. The second element for the region that that kind of a little bit sits outside of those priorities, but it's an emerging issue as well, is some of the work that, or some of the concerns that have been raised with us around, one, kaupapa Māori mental health provision for the region, and the second part is the results of the changes to whānau water provision. And because of the results of the changes to whānau water provision, there has been a threat to some of the navigation services and also the CPCT provision as well. So there were some decisions that were made, some funding decisions that have been made since the establishment of our community health plan that are now bubbling up as priorities. So although we've got those priorities that we defined and developed back in August, September last year, there are actually new and emerging priorities for the region. So our work now is, so we haven't received all of the monitoring information from the Ministry of Health, from Health New Zealand, but what we're working on now is identifying for this particular region, what are the specific monitoring priorities you'd like us to deep dive into, and some of that will have to do with some of the immunisation stuff, if there's more advocacy that we need to do on that role, and also the navigation services. But that work is ongoing as well, and so we'll have a specific monitoring program designed specifically for the Tararoa region.
So to that, through you, Chief Scott. Thanks, Naomi, because I think it's really important. Those are indicators of what is tracking around this particular district. So thank you for that. So given, where do you think the IMPB's influence will be in advocating at that regional level for the funding? Because to me it sounds like you may have a role of applying a lens on what they might be planning and knowing that for Tararoa that would mean this, for Livina or Taki it'll mean that. Is that the role that IMPB will play, or will you be a voice at the table that probably won't get listened to? Just saying.
So I'm somewhat sceptical and somewhat optimistic, and it depends on what day you get me. But what we've been told is at a regional level, the IMPBs will have a responsibility at sitting at the decision-making table around where the commissioning of services occur. So that's that has been a commitment that Health New Zealand have made with respect to the role IMPBs play in the commissioning space as well. And that's an important role that I've continued to push. Now that function doesn't officially kick off or is officially integrated into the Health New Zealand system until 1st of July. So the work that we're doing now around identifying what those specific priorities are and then looking to undertake our monitoring function, identifying specific monitoring priorities for each of the different takiwā, and then advocating at that table will not be starting to July. So up until then, this has just been the preparatory work until 1 July when that all kicks off. But what we have heard is that we're sitting at that decision-making table around the commissioning of services, and that importantly, the role of the IMPB is to influence around what the local priorities are going to be in relation to the services and investment into services within the community. So that's what we've been told. We do have a statutory power in relation to that, which is very different and exciting at the same time. But I'm yet to see a true commitment. Yeah. Hence the optimism, but also the. Yeah.
Thanks very much, Naomi. I have got a question from Councillor Franklin, then Councillor Wallace.
Again, thank you, Scott. And I'm breaking the rules again. I'm not going to ask a question because I think that your presentation certainly opened my eyes a lot to how this is trucking along, and having tried to get you here before, and we've finally made it. Thank you so much for taking the time, Naomi, because it was so interesting. And as Councillor Sharon said, you know, she and I were on that committee all those years ago, and how it's changed, and how the whole thing has evolved and changed into almost a completely different model in that sense. But, you know, let's face it, things change and we have to move with the time. So really grateful that you could come. So thanks very much.
Thank you. You're welcome.
Thanks very much, Councillor Franklin. Councillor Wallace.
Thank you, Chair Scott. Yeah, thank you for your time. I'm quite blown away because what you're saying is regional health plan, right, is for all. Okay. But community health plan is not funded for Mary in an eggshell. Yeah?
Yeah, that's right. That's correct. So for the community health plan to be funded, we must negotiate the inclusion in the regional health plan.
Okay, so are you far away from doing that? Because I feel that you're at a disadvantage. I mean, we're all human beings.
Yeah, thank you. Thank you.
There's only one race, the human race.
Yeah.
And I just don't get it.
Yeah, yeah. It's it's a difficult space to operate in, and particularly particularly at the moment as well, and so because of all of the change that's occurred across Health New Zealand and across our health system, they still haven't developed the regional health plan. And so now that they've confirmed the new structure for Health New Zealand, what has happened for us in the development of our community health plan is that we've now identified what those priorities are, so that we can then advocate for inclusion once Te Whatu Ora, once Health New Zealand start to develop the work on the regional health plan. But until then, there is, across the Māori Health Directorate within Health New Zealand, there is some provision of funding that is included for the purpose of IMPB commissioning. So that fund sits outside of the regional health plan, but it can get some runs on the board for community development and the improvement of Hauora Māori outcomes.
Naomi, thank you very much. Thanks for all the work that you do. Thanks for travelling over to share some of that with us. We're incredibly grateful. So, thanks for everything. Really appreciate your time.
Thank you all for having me. Ngā mihi.
Ngā mihi, thank you. And with that, we will just adjourn for 15 minutes. So. Thank you all very much. Welcome back. We're going to jump back to item 4, which is the confirmation of minutes. So before I take the motion, is there any amendments to the minutes that anyone has seen? No, appears to be none. Could I please get someone to move that it's a true and accurate record? Moved by Councillor Sutherland, seconded by Councillor Chase. All those in favour, please say aye. Against? Motion carried. Thank you. Jumping now on to item 6. Is there any notifications of items not on the agenda? There appears to be none. Item 7. Is there any declarations of conflicts of interest in relation to this meeting's items of business? There appears to be none. So I will hand over now, starting at item 8 of reports. I'll hand over to Carter.
Thank you, Chair Gilmore. Just as a generic comment, you would have seen the new format of the management reports. We are always looking for ways to improve the way we do things, so we really welcome your feedback on any of these ways that we are trialling. So the format of the report is that each officer will present the report about their own area of functional area. So starting with Carsten presenting the communications management reports. Thank you.
Thanks very much, Carter. So welcome up, Carsten, for communications.
Kia ora koutou i tēnei rā. Good afternoon, everyone. I will take this report as read and will be happy to take any questions as I take you through it. So as Carter said, there is a new template for this, which is focused on providing a more high-level view, and that's what I'll try to do in my presentation now as well. I might go into a few details if I think they're important. First of all, I'd like to flag up that one of the staffing issue, which is in orange there. I'm happy to say that that has been solved now. This was evident during the reporting period, the 15th of February to the 15th of April. So we had one team member who was absent, and that coincided with the heavy workload that we had due to a large number of consultations which were going on. But as said, I'm very happy that this has been solved now. Okay, moving into consultations and engagement, we've had a large number of them in the reporting period. So you will see that there are 6 here. In fact, there were 7 because the Freedom Camping Bylaw, there was an engagement, and now we're on the consultation as well. So there were 2. So we had factually 7 consultations in a period of 3 months, which was quite frankly not ideal. It's put a lot of pressure on the team, and I think it's also one of the contributing factors to some of the low engagement that we've had. With the exception of the Freedom Camping Bylaw, which had the most engagement of all these things, interestingly. We are obviously very concerned about low levels of engagement for some of the important items, and we're really working to do things differently. We've been reaching out to other councils to see how they do things. I must say that I haven't learnt a lot yet from other councils on how they do things. They seem to be doing things along the same lines as we have been doing, and the fact that a lot of people are not submitting to consultations is not only the Tararua district, it applies to other districts too. We will be working closely together with the Community Engagement Advisor, though, to see how we can do things differently, and you will be hearing more from us soon. And what I also really hope is that some of the information that's coming out of our comms survey can inform this as well. Now, going into some of the campaigns that you see there, most of them are routine campaigns that we do every year. I'd just like to highlight the campaign which is currently, we were in the planning phases when we were compiling this report, but it's now ongoing. That's for Te Ahuaturanga, the Manawatu Tararua Highway Communications. So that's ongoing now, and you will soon be hearing and seeing a lot more around this. Projects, we continue to work together with Mike and the PMO team to provide updates on this. This is, a lot of the updates are reflected on our website. It's part of a broader concept and a broader approach that we have to update the content of our website. This is an ongoing thing. We have a lot of pages on our website, close to 500, and it's really important to keep on top of things. And so a lot of the project information, for example, was heavily outdated, and that's one thing that we're working on now. Just very briefly on the website, we've been, the top pages continue to be the cemetery search on our website, together with the rate search and the roading page. Our priorities for the priorities for the upcoming period are the local elections, obviously, for which we've been planning, and now we're in the process of making some of the deliverables for that. You will be seeing more of that soon. And also the wrap up of some of the consultations that we have had. And this is a really important thing, because in our comms we really want to strengthen the fact how people's feedback has been considered, and we want to bring that to the forefront in our comms. And this is all with the general idea to build more trust and to add to transparency. Another priority which we have for the upcoming period is our comms survey. I briefly mentioned it before. The comms survey is ongoing, and we are tracking well with the number of respondents. So we currently have about 120 people who have responded, and we still have a couple of weeks to go, so that's all right. I hope to get a lot more than that. Just very briefly about the comms survey, we find this really important because it really has informed our direction. For example, more radio. This is something that has come out of the comms strategy last year. For example, targeting digital devices and knowing what to target. So, for instance, Stuff, New Zealand Herald, etc., etc. So, doing our geotargeting on those digital devices, something that directly came out of the comms survey. Another thing which I'd like to highlight is dog rego. It's not on the list, but it's definitely a priority in this period. Last year, we went all out on dog rego. We incorporated a lot of the findings from that comms survey that we had and did a lot on the radio. We geotargeted TVNZ, for example, as a test, and we've had really good feedback on that. One of the key risks that I've flagged up in this report is managing information and disinformation. Especially within council, sometimes we have processes, and to provide accurate information we need to go through those processes, but in the meantime people can put things out on social media which are not correct, and they can lead their own life in a matter of hours. And as a council officer, it's really hard to keep on top of those. Now, again, this is not only a Tararua problem, this is a problem which other councils are dealing with as well, and in fact it's a global problem. I've also heard that misinformation and disinformation has been added to one of the top risks of our emergency agency, NEMA, and it's also in the national security strategy. It's made its way into one of the things which is the most threatening to the New Zealand society at the moment. Now, moving on to the key performance indicators. Facebook followers, we continue to see a sharp, or an uptrend, not a sharp uptrend, but a good uptrend in Facebook followers. And also in our website, we see a slow increase. So we've had a 17,800, we've had almost 18,000 visitors on our website, whereas in the previous reporting period we had 15,000 people, so it's up quite a lot. The second performance indicator is about the number of submissions or feedback forms which we have received. Now this one, in hindsight, we should have done this differently, because we will have a larger number of submissions because we had more consultations. So in hindsight, I think we should have specified that one a bit more. And as I said previously, we will have an increased respondents to the annual communication survey. We're tracking quite well on that. Trends. So overall on Antenno, we've perceived an increase in reports about graffiti and vandalism. We've pushed 45 notifications out on Antenno, and we've received 165 from residents. In the last committee meeting, Councillor Wars asked how we were doing with our Antenno and how many people subscribe to this. I've reached out to some of the colleagues in the region that are using Antenno. One of them is Hora Whenua. They have 578 followers, and one of them is South Wairapa. They have around, I think it was 901 followers. We have 979 followers. So we're actually not doing too bad, but there is a lot of scope for improvement in this. So we really need to push that message that Antenno is actually really helpful. Now just going through some of the website, the stats. So website visitors, yes, there's a steady increase in the number of visitors. Last year, what I must say about this, we haven't reported on the month of April because it's the reporting period was until the 15th of April, so you get a skewed number there. So we've reported until March 2025, and compared to March last year, we're looking pretty good. We have 8,500 in March this year, and we have 7,600 in March last year. Social media is looking good. There's been a slow but very gradual uptake on followers. We had a big boost recently because we did this. I don't know if you've seen this. We did this Facebook post. There was a drive-through of the new highway. And it went viral, and it's resulted in a lot of followers and new followers to our Facebook page. I cannot quantify the number yet because it's still ticking upwards, but I will come back to you with some more information on this. What I can say is that we had about 75,000 views, and that about 20% of the people were people from within the district and 80% of the people were from out of the district, which is really interesting.
Through you, Mr. Chair, could I ask the question, who has seen that? Who has?
Sorry, Councillor Johns, can we just wait till Karsten's finished? I've got other people in the queue for questions, so I'll come to your question after, thank you.
Okay, moving on to Facebook posts. So we've seen a large uptake in our Facebook post, and this is of course because of the busy period that we've been through with the large number of consultations and engagements that we've had. Private messages, we've responded to about 40 private messages. Some of them have resulted in CRMs, and we're always trying to push the message in these private messages to get people to go onto NTNO, because a lot of them, they say, oh, there's a pothole there, there's a tree that's fallen over there, and we're trying to say, okay, that's great, we'll put in a CRM for you, but you can do it yourself through NTNO. Actually, the number is a lot higher than 40, because one request can result in 6 or 7 questions from someone. We've had 12 media inquiries this reporting period. Again, you know, at 12 it doesn't seem like a lot, but I'll just give you an example. We had one media inquiry which consisted of 28 questions. So yeah, it can be a lot of work. Okay, 31 media mentionings, and we've had 23 media releases in the reporting period. With that, I'd be happy to take on any questions. Thank you.
Excellent. Thanks very much, Karsten, for your comprehensive update. It is clear how much work is going on in comms. I'll have a couple of questions, but I'll wait till the end. So if we start off with Councillor Wards, please.
Thanks, Chair Scott. Great report, Karsten. Can I take you back to the key risks area? I'm curious to understand, you've mentioned that there's a bit of a process to make sure that we respond accurately to misinformation. Can you take me through, I guess I'm curious to understand how many levels. So you can't just sit there, or your social, because we have a social media resource, don't we? They can't just sit there and go, oh, you got it wrong, I'll just How many, I guess I'm checking on the authority levels, and do we have a job description for that social media or the external comms that gives them the authority to actually respond based on their level of knowledge and their level of, or how many hoops do you have to jump through before?
Yes, we have a level of authority. If it's something that is considered a risk, we'll obviously have to ask. We'll have to go higher up in the organisation to get sign-off on it. But I think one of the things is that I'd like to highlight is also that we don't have the capacity to be on social media all day. And in the meantime, things can evolve. I mean, we are keeping a side eye on it, but for us, and currently the way it works, our social media and engagement person is on, is on Facebook the first hour and a half of the day and the last hour and a half of the day. And in between, she does other things. So that is also one of the risks that we're encountering. Yes, for some things we need sign-off, but also sometimes for us it's getting information from the subject matter experts within the organisation, and people are on leave, people are busy, people are not picking up their phone. And this can take time. Yeah, and in the meantime things evolve and they snowball. Yeah.
Thanks very much, Councillor Wards, and I might just jump in here because my question was very much on similar lines to Councillor Wards, and I did see that part of which can sound quite frustrating for the comms team, waiting for information to come when perhaps things might be blowing up. Are there any discussions, sort of from your level on how that process might be able to be streamlined? Because, there has been a few examples recently which, if they're not nipped in the bud, they're probably going to end up creating a huge amount more work for communications and, frankly, a fair bit of time for governance as well. So glad that you've identified that in there, but have you been working through any solutions on how to streamline that?
I guess, again, it comes down to capacity. And it's also something that that we want to flag up with them, with other managers, that it's really necessary to respond timely, and this is something that we continue advocating for within the organisation.
Fair enough. Thanks very much, Carsten. I'll hand over to Councillor Johns.
I think the question's been answered, Chair Scott.
Thanks, Councillor Johns. Councillor Wallace.
Thank you, Chair Scott. Yeah, through you, the Chair. Doom scrolling. This is what we're dealing with. These people are so positive. They sit in their chair and doom scroll all day. And sadly enough, and I think you hit it on the head, don't lower yourself, because I think it comes back to this room. There is some intelligent people in this room, and we deal with facts, And I would like to think, our opinions do count, and we do our due diligence, and so do the people that work for the Taurua district. We're always going to get shot by a lynch mob. They're out there because they're doom scrolling. And I don't make any apologies for the doom scrollers, because that's what they are. And we're not going to be tried by Facebook. We're going to be tried and trusted and tested by our peers, the voters. And I put faith in our system.
Thanks for that. Those comments, Councillor Sutherland.
Thanks, Chair Scott. Just a comment and then a question, really. Just your first question, Carter, through Scott. I think the template's fantastic, actually. Really tighten this up. You can a pretty good glance over the thing. It's got all the facts you need, and then it's just questions. So 10 out of 10 for me. Just a question that may be appropriate to Carter or to Brian. I'd just like to know how many staff are in the comms branch. And don't have to answer me now, but I'd just be interested in what staff numbers are in this part of our group. Thanks. Because staffing's been commented before, has been talked about before in the comms, not today, but before, and it's obviously still there. So I'd be interested to know what capacity we do have in comms.
Through you, Chair Gilmore. Currently we have a communication manager, and underneath the communication manager we have 4 staff. One of the staff at the moment is on maternity leave until the end of the year.
So we have 5 normally. Right. 5 full-time?
Any other questions, councillors? Carsten, just wanted to thank you for the work that you do. It is really clear in your report how much has been going on with consultation, but there is it's been a very, very busy time, it would be fair to say. So please pass on our thanks to you personally, but also to your team. And I also just wanted to echo Councillor Sutherland's comments about the template. Top notch from my perspective. It's pitching the information absolutely at the right level. So very grateful for that. Thank you. Thank you, Carsten.
Through you, Chair Gilmore. The next report we have is the Community Facilities Report presented by Fontaine. Thank you.
Kia ora koutou. Take the report as read. The status report looks a little too colourful for me. However, just give you a bit of explanation there. Through cemeteries, you would have received reports, and through your visits as well, around the health and safety issues that we have there with our trees, especially at the old gorge. Tree maintenance is a major concern for us across the district. And then some sensitive issues there dealing with degraded plots. Budgets for this reporting period is over. We're over budget, but we are on target for the end of financial year. Community buildings, at the time of writing the report, we lost a staff member, which was our asset supervisor, and have since picked up a new facilities officer who started last week. So we can remove that. That can go back to being green. Health and safety issues there, we have through our electrical meter boards and some of our community buildings, there are asbestos boards that need to be upgraded, so I've just highlighted that as a health and safety. Budget-wise for that, it didn't budget for those upgrades, although you would have had that discussion this morning, and Sarah has fixed that problem for us too. Parks and reserves, health and safety, we had that discussion through one of our audits there as well around the pests and pest plants. So we've engaged with our partners at the Horizons Regional Council, and their pest control team there have been out to Anzac Park we were out at Anzac Park after receiving reports of a large number of possums that were in that reserve there, which was quite worrying. They managed to cull in one night 40 possums. Yep, so it's really bad. So we've got them scheduled to do that on a regular. So their next visit is going to be after the summer season. So what's happened out there is that all the surrounding farms have all been baited. So the only home for them is the reserve. And the reserve's not being baited. There was, from my understanding, there was some work, a community group that came together some time ago that we're planning to set bait stations there, and then pulled out of that, and I don't actually know why, but we've got Horizons on board. We've got our own compliance team as well that will go out and do some checks across our parks and reserves. So that's a major issue for us, given that, one, it is remnants of 70 Mile Bush, and also it boundaries very, very closely to a dairy farm. So we're going to keep a really close eye on that. Pensioner housing's looking great. Public conveniences, staffing issues resolved. Health and safety, that is in regards to the meter boards. Swimming pools, we're working through that through our 17A. Campground highlight for health and safety is really around what we already addressed through the audit and risk, and that's around finding a solution for the undermining of that bank that's there. So Horizons have informed us that they do not rate for bank protection, and they're part of the Mangataras stream. So there's no support there, but they do rate for river management work, which could hopefully they can plan in to take off some of the inside bend. But they don't. But that's not going to resolve the problem altogether. There is still a bank protection work that will be required sometime down the track. Damn it. Any questions so far?
Thanks, Fontaine. Is there any questions? Fairly another very comprehensive report, so thank you, Fontaine. But no, there appears to be none.
No.
Oh, sorry, Councillor Johns.
Thanks, Chair. Scott. I see under Parks and Reserves, resources required to establish a tree register. Under the current district plan, we have a tree register. Is it intended to seek, call it nominations, for additions to those trees, or a review of what's already there?
So under the district plan, our significant tree register. It isn't a register of all the trees that we have across the district. So what's native that needs to be protected or needs permits for works to be done, we don't have that. That's what I'm asking for in that piece. It is separate from the significant trees. We've noted and mapped out all the significant trees across the district according to the district plan. We've done that part. But what we don't have is we don't have in our reserves, in all our parks and reserves, a tree register that highlights the memorial trees that were planted, any other native trees that need to be protected or require permits for removal, any works to be done. We don't have that.
Yes, insofar as the significant trees are concerned, is it intended to seek additions to or review what is currently there?
I think having updated good data adds value and helps with decision making. Having a good stock take of what our assets are and what the landscape looks like is important for council. It's important for operators and managing that as well. So if significant trees are identified, I don't know the work that was carried out to identify and how a significant tree was classified. I don't know that yet. So all I know is what was listed in the district plan. So how do we move forward from there? And is there a desire for council to do so?
Hence my question, I guess. The significant trees was done probably 20 plus years ago, might even be longer ago than that. How it got established and what criteria was used, I don't know. But it is probably, if we're going to have a significant tree register, it will need review. Some of them may not be there, for instance, and or others that may need to be added. And insofar as the other side to it, a tree register, you would need to establish, in my view, a rationale to incorporate them. I mean, you're not going to put every tree in the district on the register, so what's the rationale for putting a tree on the register?
So over the past few, probably since I've been in the role, we've had inquiries from other organisations about what's council's tree register look like, and I'm trying to understand why do we need to have a tree register. So, and what we found was just what was sitting in the district plan. But what we have also found and discovered that through our reserves, like the issue that happened at 4 Mile Bush, there's a need for this council to protect those assets and to protect those remnants of, what the history of this district is as well. So in doing you might decide, no, we don't need to. But in order for me to go investigating whether we should or shouldn't have one, I would like some direction on that before I waste my time.
Yeah, thanks, Fontaine. can I suggest that it's a topic for discussion at some future meeting? Now is probably not the right time. We need information in front of us to know what's on there currently.
I'll just give the Chief Executive a comment.
Thank you, through the chair. Yeah, I think it is worthwhile doing a bit more work around this, just not necessarily what goes on the register, but there are other pieces of legislation that does provide the protection against some of these trees that you're referring to. So the Reserves Act is pretty clear on that a process should you have cut them down or anything like that. And even as far as the one plan through the RMA also has protections in there for especially the remnants and part of the more of a biodiversity aspect of it. But some of these trees may then not be located in those locations, and generally those are the ones that you pick up through your district plan and be similar to a heritage tree or a tree of significance. So there's different categories that trees can fall in and not necessarily be through the RMA, or sorry, through the district plan, but there are other protections for those ones. And obviously the Pongaroa tree being one of those that was actually protected under the reserves and in fact under the one plan as well. So yes, agree there's some work required probably to have a better understanding on where all these trees do actually sit and which ones aren't covered under a bit of protection. We need to ensure that they're covered somewhere as well.
Thank you very much, Brian. Can I request that more information comes to a future meeting if we need to give direction? Doesn't have to be the full amount of work, but something laid out for us so it's clear on exactly what direction you're looking for. I'll move over to Mayor Tracy.
Thanks, Chair Scott. I just wanted, in regards to Anzac Park, the Norsewood Lions have always been the kaitiaki out there. Have you been in discussions with them just around the possums? And my other one was Horizons Regional Council charging us for this work. And I guess I was just thinking, 40 possums and possum fur per kilo. Somebody might be interested in doing that, but that's, massive amount.
First question with regards to the Norsewood Lions, no, I wasn't aware, but happy to engage them. With regards to Horizons paying for us, no, we're rated for that work, so that's their job.
Thanks very much for that, Fontaine. Councillor Wards.
Quick one, thank you, Chair Scott, and you semi-answered my question. So in the absence of going back to the tree register discussion, Fontaine, recently you would have been approached by the Akatea Community Centre. I asked them to ring you before they did anything. So the decision that they made, it ended up being a very simple process for them to remove that. What did you use as your guide to say, yes, that can happen or not?
So we did some investigation to see where the actual tree lay, and it wasn't on council land at all. It was private or Lynn's private. It wasn't council's anyway.
So it's Ramsden's land?
Or is it a Lynn's? So sorry, I'll have to get Kate to...
The point I'm making is it was a very simple process that they followed, so I'm grateful that you're able to advise them rather than go through all the hoo-ha that we've had somewhere else. So, okay, it wasn't even on the register.
Thanks for that, Councillor Wards. Is there any other questions for Fontaine? I'll just hand over to Carter.
Thank you, Chair Gilmore. If I can just make a very quick observation here or comment really around the asset register, the tree register. From an operational perspective, we are unable to budget for the tree maintenance because we don't know what trees we have at the moment. So, and what we are doing at the moment is just reacting to whenever a tree falls down or whenever we need to do some trimming. So really at the very least from an operational perspective, having that plan, having a good overview of what trees we have and we can plan for their maintenance would make it a lot easier for us.
Yeah, Councillor Johns.
Thanks, Chair Scott. Thanks, Carter. From memory, probably half or more of the trees are actually on private land. Others from the likes of Fountain Square, Paetua, Main Street, that sort of thing. And are under pretty good care as it is, I would think. But those on private land, it's a question of what does it mean? Is the landowner entitled to cut them down or not?
Thanks very much, Councillor Johns. And I suppose that was part of me wanting something else to come back, because I think sometimes there's more implications than what we realise before staff go and do a huge amount of work. So super important. Fontaine, did you have anything else that you wanted to add in your report?
I'd just like to highlight the camping ground stats for Woodville and the LTP engagement. We were asked to come back with a review of what the bookings were looking like. No, it's not working. It doesn't look great, but bear with us, because as we go through our 17A review and we employ some new tools to help us promote our camping grounds with better reporting, the intention is to grow that space.
Fontaine, thanks for that, because I was going to ask about it. And I must just give you full credit when it comes to not just looking at raw numbers, but looking at how things might be as some of our other plans start to take shape. And we have talked a bit about Woodville Campground in particular. And personally, I think there could be some opportunities to try there. So that's really encouraging to hear. Does anyone else have any further questions for Fontaine from a facilities perspective? Well, thank you very much for presenting. Again, thank you for all the hard work that you and your team do. We're really appreciative. Thanks, Fontaine.
Thank you, Chair Gilmore. The next two reports will be presented by Sandy for the customer services and the library.
Welcome, Sandy.
Kia ora koutou. Thank you for your time. So the first report for Libraries Tararoa, apologies that Brenda wasn't able to be here today, but I'm keen to just take the report as read and focus on any areas of interest from you all.
Thanks very much for that, Sandy. Another comprehensive report. So do we have any questions first off on libraries? There appears to be none, so I'll hand back over to you for customer services.
Wonderful, thank you. In respect to customer services, I did just want to provide a couple of highlights. So firstly, in regards to the integration of services. So I just wanted to provide an update on where we're at with that process. So we have confirmed the new structure, and that is effective 30th of June. And we're currently in the procurement phase for the Woodville Ice site plans to be developed. The only other update was in regards to the abandoned call reduction. So this largely relates to our staffing levels over this period. We have looked to train up more staff in managing the incoming phone lines, so that has resulted in that reduction. So those are the main things, and happy to take any questions you have.
Thanks very much for that, Sharon. I'll start off with Councillor Wards.
Thanks, Chair Scott. I tried to have a wee dig around in here, Sandy, to understand the implications of the information centre closure. I mean, our community's been reassured that our frontline staff at the service centres will be picking up those roles. Does that mean our staff have been trained on how to do bookings and tickets for everything that the community were concerned about? Our staff have the systems in place already, or will that happen before the end of June?
So we have been through a process looking at the current services provided through the Dennyburg Information Centre, and we have looked at what services we will continue through either customer services or through libraries, and this is in Dennyburg obviously, so either through the Dennyburg customer services or the Dennyburg libraries, and also through our communications team. So we've divvied those into various areas. Our eyesight manager from Woodville is going to be working with us closely on making sure that the staff here are upskilled, and yeah.
Don't foresee any issues then?
Don't foresee any issues, no.
Thank you.
Thanks for that, Sandy. Councillor Wallace.
Thank you, Chair Scott. This is down at the Woodville end. If you go to Woodville and you want to get in there at 1 o'clock, no one's... Yeah, I might get the hours wrong, but anyhow, they all go for lunch at the same time. So depending on when you strike it, right, it's either lock and come back. Has that been resolved with this new, the way you're doing it now, please?
I'm sorry, Councillor Wallace, I can't recall that off the top of my head if we are changing that lunch break, but what I can tell you is that if it isn't resolved through this process, what we are doing is through the next long-term plan process, we're using some data from our IoT people meters that we've installed to tell us about the levels and volumes of people coming in, how people use libraries. We're hoping that that will help inform discussions with the council about levels of service and opening hours so that we can do a full review.
Supplementary, the road opens this month. I would hate to be over to an eyesight centre. Sorry, I can't charge my car because all the Tesla stations are full. I want to carry on. I want to answer a question. And, we're gone for lunch. I want to get somewhere else. It's a now thing.
Yes.
I don't think we can wait a year. It's an operational thing. I think that could easily be solved, in my opinion.
Completely understand. I think I'm 90% sure that we have reduced the closure during the lunch break through this process, but I just need to go away and confirm that, if that's right.
Through you, the chair, yes, I think this committee here would love to hear the reply to that. Thank you.
Oh, yeah, sure.
I'll invite the Chief Executive up.
Is that okay, Chair? Thank you. So just further to that, one of the issues is obviously the layout of that facility. So they're separate at the moment. So there is a project, and you'd see it through the reports. That there will be a way where the staff that are there can manage both sides. So we're pretty confident that those closing times will be a lot less. We can't control people's health and the like and other absences, but one of the goals of the integration of services was to keep these facilities open, but also layout is a factor, and we have got a project underway to look at the layout to ensure when you walk in that door you can be served. Whoever's in there can look after both sides of the building, and that is work in progress.
We've opened up a few more questions, so I'll jump over to Tracy, then Peter, then Naoma.
Thanks, Chair Scott. Sandy, I was just thinking about when the information centre services flow over. Obviously, there's interest around this table and in the community. What processes have you got for recording and reporting and monitoring and sort of feeding some of that back as to how it's going, what those stats might look like for us, and just the different services that have been requested? Because I'm not sure that we haven't actually had that data before.
Yeah, sure. That's a really good question, and it can certainly inform some of this report. So if we provided something similar just to keep you updated on the key stats that we're getting through the door and things like that, we can absolutely do that.
Thanks very much for that, Sandy, and I've just asked for Simone to make sure that that's noted down because I think that'd be of real value. Councillor Johns.
Thanks, Chair Scott. Sandy, the library, will that be opening from 9 till 12 on a Saturday, as we've discussed in previous occasions, now that the nature of the facility has changed?
Is that in Woodville? Are you
In
talking
Woodville.
about? No, there aren't plans for that currently.
Has it been something that you've considered?
Not through this process. This process was largely about integrating the two services. We weren't really too focused on the levels of service opening hours that had been previously defined through the LTP process. We had always intended to do a review of the opening hours as we move into the next LTP, because that's really what we're budgeted for.
And I think, further to that through the chair, is that as we get more data, it will be able to drive better decisions in terms of those opening hours and closing, or opening days, for instance.
Good point.
Yeah.
No, thank you, Brian.
Thanks for that. No, great question. Councillor Chase.
Thank you, Chair. With you working on the integration of services at the Woodville area, being that there's been a bit of some attention to the Dannevirke, is that going to be built into at the same time as the Woodville working with the Dannevirke services being integrated here? Or is that going to be the next step after you've fixed Woodville?
Sorry, are you referring to the Dannevirke Information Centre services coming into the Customer Services Libraries team? That is happening as a matter of urgency as the Dannevirke Incorporated Society winds up their operations downstairs.
So that would be, so you're going to inform the community about all of that? Because like we've already discussed, we need to take the community on that journey. So it would be really good if that is happening, that we kind of put that messaging out that we are actually working with the library, our council office, that those services will be integrated, like just kind of drip feeding that information to the community, because that is something that is actually needs to be done, so that we are taking them on that journey, because we've heard lots about what's happening over in Woodville, but this is probably the first time I've heard that we are actually doing something in Dannevirke, and it'd be kind of nice to be able to get that out to our community to say that it is happening, that it isn't just going to shut doors, that we are working with the library, we are working with our customer service and the Tauranga District Council, and that we are slowly merging. But it would be really cool if we could take our community on that journey and say, this is the service that's going to be delivered in the library, the service is going to be delivered in our council office. I'm just asking if that can be done.
Thank you very much. Councillor Chase Carter would like to make a comment on this.
Thank you, Chair Gilmore. That's certainly something we can do. We'll work with the comms team and integrated services, and we can make that happen. That's we'll just do some planning around the comms, get a better understanding of the integrated services, what services will be provided where and when, and we'll get some comms out.
Thanks very much for that, Carter. I wholeheartedly agree, so thank you very much for raising it. Councillor Wallace.
Just like to say, I have read all that, and it has been told to the people that we are doing that. So I just, maybe another add on 2ZB.
Through your chair, yes. So there was an initial media release that did go out after the, I guess the noise that was with the closing of the information centre. So our comms team did release a media release to explain quite in depth of how that process and how we would pick up the work. But I also think it's timely that we go out rather than responding to some noise proactively and reinforce what we're doing. I think it might even be a bit broader, where we can say
where we're at in terms of our wider integration services LTP project, really, at the end of the day, and how it's going to benefit, I guess, the community with how certain aspects of council will take over certain areas, and then even maybe with a piece in there that actually also includes how pay tour will be, a reminder that pay tour will be the next cab off the rank in terms of how we go about that. So it's wholeheartedly transparent, and we're starting exactly how we like to finish, and we can keep providing those updates as we move through the process, because there is a lot of community interest in this.
Thanks very much, Brian. Thanks, Carter, for the information. And I do think it's great to have a press release out there, but this is all and stuff we were talking this morning about, is how we're taking the community on the journey with us in a proactive way instead of a reactive way. So really encouraging to hear those bits. Sandy, did you have anything else that you wanted to add? Does anyone else have any questions for Sandy or Brian? No? Thank you both very much for coming up. And Carter, did you have anything else overall for your report that you wanted to cover off?
Thank you. Just as Carsten was talking about the Facebook and the messaging and the capacity, I remembered the time when we talked about the importance of not reacting to every single message on Facebook, and how we can just step back a bit and maybe do a bit more analysis into the themes that are coming through and do some myth busting and all that. So it is a capacity issue, so we can't really react to everyone, and we shouldn't. Even if we have capacity, I don't think we should just sitting there reacting to every. I just thought I'll comment on that again, because this is something we have talked about in the past. Thank you.
Thanks very much, Carter. For what it's worth, and I have mentioned it before, but I do want to again compliment the team on how in general, the council Facebook page has been monitored and managed in a informative but light-hearted way, which seems to have diffused a lot of commentary, and also the upholding the standards that have been agreed. So hats off to the team for that. Thank you very much, Carter. Thanks to all the staff that have presented in this report. We have a recommendation on page 23 that the report from the Group Manager, Strategy and Community Wellbeing, dated 14th of May, concerning the management report be received. That's moved by Councillor John, seconded by Mayor Tracy. All those in favour, please say aye. Against, motion carried. So that one there's done, and then I just want to do a quick walk back very quickly, back to the confirmation of minutes, if I may. Confirmation of minutes, the recommendation was on page 2. That was moved, I believe and seconded by Councillor Sutherland and Councillor Chase, neither of who were at that meeting. So I would like to rerun that. Moved by Councillor Wallace, thank you, Steve. Seconded by Councillor Wards, thank you, Sharon. All those in favour, please say aye. Against? Motion is again carried. Thank you all very much. That's how we roll sometimes. We get there. Thank you all for your participation today. We had a lot to cover in the meeting. I'd just like to ask, would you be happy to? So I'd just like to hand over to Councillor Chase to do a closing karakia. I'd like to hand that now over to Councillor Ward. We opened with a karakia, so I'd like to close with a karakia. So I'd like to hand over to Councillor Wards to do a closing karakia, please.
O te wahi naro, mai runga, mai raro, mai roto, mai waho, ui e, tai ki e. Lay upon me the care of the universal forces from above, from below, from the inner self to the outer self. Let it be affirmed. Yes, it is affirmed.